And for the next finger issue we should be discussing this evening is what is known as a trigger finger. Trigger finger. Alright. So for the trigger finger, what we have here is this. Can you see that you have a healthy finger, and your healthy finger normally, if you're not holding a gun trigger, it should be flat like that, you understand? Except it's you that want to flex your fingers. So a trigger finger, this finger especially is kind of like permanently looking like you are holding a trigger. Do you understand? Now there are several reasons why your hand could actually appear like this. Now let's look at them. Now trigger finger, you should know that it's also known as what? Stenosing tenosynovitis. Right? Most of the times you find people being calling it like that. So it's a condition where one of your fingers gets stuck in a bent position, then suddenly snaps straight. It gets stuck like this. Then sometimes suddenly it now goes straight again. Can you see? If you try, it might just go straight all of a sudden. So what's happening inside? Your fingers bend, and this is thanks to the flexor tendons that slide through the series of pulleys. But in trigger finger, the A1 pulley becomes inflamed or thickened. So there's issues right deep with your tendons. Tendons are getting inflamed. So this causes catching, locking, or popping during finger movements. So common causes, it could be due to repetitive gripping, like you have overused your hand. Medical issues like diabetes, rheumatoid arthritis, gout, all of these have actually deposited a whole lot of things. It could be crystals, it could be glucose deposited in the tendons. This is what have actually triggered the inflammation. So occupations or hobbies involving frequent hand strains, like musicians play guitars and all of that, type piece, just like me that type a lot. I just pray this doesn't happen to me. Okay. So symptoms: there's pain, tenderness at the base of the affected finger or thumb. It's a clicking or popping sensation when moving the finger. Finger stiffness, especially in the morning. Finger is locked in a bent position. Okay. You can see another picture trying to show it. Okay, it's a trigger finger. So diagnosis and treatment. Well, diagnosis is simple. I'm looking at the issue. I can actually confirm, except if I want to do imaging to know what has actually caused it further. So conservative options for treatment is rest. So reduce the way you are using that part of the body, okay, to help recover more. Splintings, then non-steroidal anti-inflammatory drugs for what? Inflammation and stretching the finger therapy. Okay, so that was what this trigger finger simply is in orthopedics.